We can see that there is definitely a change in size between the left and the right. Okay, so he's had some atrophy, muscular atrophy that has occurred. Externally rotate for me, push, 1, 2, 3, rest. Again, 1, 2, 3, rest. Let's go, 1, 2, 3, rest. Again, 1, 2, 3, rest. I think sometimes there's some doubt around whether the electro-stimulation actually improves the strength because I am using manual muscle testing. Let's go. 1, 2, 3, rest. Let's go. 1, 2, 3, rest. Let's go. 1, 2, 3, rest. You are closer. 142. Whoa. It improved by 56%. There's a big difference, okay? What's up, everybody? Dr. Ranen here. Today we have Justin with us. Justin is a long-standing patient of mine. 9 weeks ago, he had a distal bicep avulsion tear. So essentially, the bicep tendon came off the bone. He's been in recovery. As you can see, he's obviously not in a cast or in a brace, so he's outside of that period. He's been undergoing physiotherapy for the last couple of weeks. He's already had 5 physiotherapy sessions done. Today, what we're going to do is something new and interesting. We're going to use a dynamometer from Vald. Vald is a performance testing company. And what this instrument does is essentially measures the isometric strength of a muscle. So there's 3 types of muscle actions: isometric, concentric, and eccentric. And isometric is basically kind of a stability frequency of the muscle. And it's a good idea. It gives us a good indication on what the muscle output is like. You know, is there any motor control? Is there no motor control? Can the brain connect with the muscle? So we're going to run through a system of assessment. I've already preset the device. We're going to run through a system of assessment. We're going to do the unaffected side first. We're going to do the affected side second. We're going to compare to see what the difference is in strength. Then we're going to do an electro-stimulation, and we're going to retest. All right, let's go. Okay, guys, so from the outset, if we're just observing Justin's arms, we can see that there is definitely a change in size between the left and the right. Okay, so he's had some atrophy, muscular atrophy that has occurred, which is going to get better over time as he starts training and lifting. All right, so you're going to stand for me, please. So you're going to make a fist. All right, so we're going to do internal rotation, okay? I'll tell you when you're going to push. You're going to push for 3 seconds. I will do the countdown, and then you'll stop. Okay, push. 1, 2, 3, rest. Push. 1, 2, 3, rest. Push. 1, 2, 3, rest. All right, now you're going to do external rotation. All right, externally rotate for me. Push. 1, 2, 3, rest. Again, 1, 2, 3, rest. Again, 1, 2, 3, rest. Relax. Great. Let's go. 1, 2, 3, rest. Go. 1, 2, 3, rest. One more time. 1, 2, 3, rest. Great. Okay. Now we're going to do brachioradialis, so make a fist for me. Okay, let's go. Not the wrist, hammer curl, yes. Okay, 1 second. Okay, let's go. 1, 2, 3, rest. Again. 1, 2, 3, rest. Again. 1, 2, 3, rest. Relax. And last one. So tricep extension,
cool.
okay? Let's go. 1, 2, 3, rest. Let's go. 1, 2, 3, rest. Let's go. 1, 2, 3, rest. Perfect. So left side is done. Let's go to the right side. Make a fist for me. So I obviously want you to apply a force, but because of this surgical intervention that you just underwent, you may experience some discomfort.
Okay.
Don't push through the discomfort. Okay?
Just stop where.
Stop if it gets too uncomfortable. Okay? All right. So we're doing internal rotation. 1 second. All right. Let's go. 1, 2, 3, rest. Go again. 1, 2, 3, rest. Last one. 1, 2, 3, rest. All right, let's go. 1, 2, 3, rest. Go again. 1, 2, 3, rest. Last one. 1, 2, 3, rest. Okay. So abduction, you're going to come out.
Yeah.
All right. Push for me. 1, 2, 3, rest. Again. 1, 2, 3, rest. Again. 1, 2, 3, rest. Okay, so what we're doing is I'm testing internal rotation, external rotation, which is internal rotation would be your subscapularis, external rotation is your teres minor and infraspinatus. Your abduction at 30 degrees is your supraspinatus. So your rotator cuff, and then we're doing bicep, brachioradialis, and tricep. So I think I could test 1,000,001 things, but I think these would be standard for a patient that has had a distal bicep tendon tear. Okay, let's get you to go into flexion. All right, so again, careful now, right? This is going to be the most provocative one. Let's go. 1, 2, 3, rest. Go. 1, 2, 3, rest. Go. 1, 2, 3, rest. You good?
Yeah. Actually feels good to feel the bicep
Yeah?
contracture, yeah.
Okay. Let's go. 1, 2, 3, rest. Again. 1, 2, 3, rest. Last one. 1, 2, 3, rest. Okay. And the last test, extension.
Yeah.
So, yeah. You struggling to supinate?
I'm fine,
yeah?
yeah.
You cool?
Then we're done, yeah. Right.
Okay, let's go. 1, 2, 3, rest. Let's go. 1, 2, 3, rest. Last one, go. 1, 2, 3, rest. Great. Okay, so let's have a look at our report. So, elbow flexion. And this is where you see the big difference.
Yeah.
Okay, so left 152 Newton meters, right 90. Okay, difference of 40.7%.
That's a lot, yeah.
Yeah, all right. Okay, so these are other variables which we don't really need to look at right now. Let's look at elbow flexion with wrist supinated. So this is brachioradialis. Left 140, right 119. Okay, so brachialis is also responsible for elbow flexion, right? Difference of 15.2%. So not too bad, okay? And the last one is tricep. Okay, so obviously agonist, antagonist. The tricep is the antagonist of the bicep. Left 141, right 108. Difference of 23.5.
Yeah, you can feel it. So there's weakness.
Yeah.
Definitely, yeah.
Okay, so what we are going to do is we're going to do some electro-stimulation and then we're going to retest, okay? We'll have to go through the whole process of retesting left and right, but let's see if we can change some of these parameters for you. Okay, guys, so if you like what you see thus far, please hit the like button, subscribe, and if you have any questions on the dynamometer or what we're doing, please drop them in the comment section below. All right, you want to pop your shirts off for me?
Yeah.
So I'm going to start off with some of the smaller muscle parts, some of the muscle parts that we didn't test, okay? Actually, I'm thinking maybe, people on YouTube will say, well, was it the effect of the muscles that you worked on, or was it the effect of everything else? So what we'll do is we'll stick to the muscles that we tested, I think, okay? Ooh, nice one. So it was good timing when you messaged me, man.
I'm glad.
Yeah. I've been wanting to use the dynamometer for a while. There we go. You good?
Yeah.
Not too strong?
Yeah, so good.
So one of the main reasons why I wanted to use the dynamometer today is because I thought it would be nice to show guys the actual quantifiable effects of the electrostimulation in terms of improving patients' strength. I think sometimes there's some doubt around whether the electrostimulation actually improves the strength because I am using manual muscle testing. So I think we'll know whether you guys will know whether I'm BSing you or not. You good, bro?
Yeah.
There we go. All right. So what we have here is we have a needle in the tricep. We have specifically the radial nerve, which supplies innervation to the tricep. We have the axillary nerve, which is responsible for abduction. We have supraspinatus and infraspinatus, and we're going to add in two more because we worked the brachioradialis. So we're going to do brachioradialis and superficial radial nerve. So let me just clean this here. Actually, before my surgery, I actually had some physio Did you have anything done before?
But on physio-wise,
Yeah,
in terms of what?
like just mobilization or some rehab.
Just manual.
Oh, there we go.
I had no like dry needling.
Okay.
Just mainly deep,
Yeah.
deep tissue type of.
Yeah, I had the same stuff done. I think that also helped in the recovery because there wasn't a lot of scar tissue after surgery. Okay, let's do a small stim here. You okay? Not too bad?
No, we're good.
You good?
Yeah.
Okay. Nice. So, essentially, guys, today Justin is a guinea pig because I had the same injury in 2022 and I didn't have anyone to do this treatment on me, and I think it would have made have had a big effect on my recovery. So Justin is going to be the guinea pig to tell us if we can be effective. All right, here we go. How's that in the back?
It's all good, yeah.
How's the forearm?
Form's still good, yeah.
Great. So 5 minutes and then we'll work on the bicep. Oops, we got a few bleeders here. 1 second. Okay, let's get you on your back for me, please. All right, let's let you rest your bicep here.
Do you see many patients with this sort of injury? Not really. Not as many.
Not really, man. Like, sorry, here you go. I think that may make you more comfortable. I don't really work with post-operative patients. Like I said, I have been wanting to treat someone that's had a bicep tendon tear so that I could kind of experiment and see, like, using the dynamometer, what effect we can have in improving their strength. But outside of that, it's not something that I like, cases that I like working on. There's a lot of rehab that's involved, and I just don't have the expertise to take patients down that. Basic rehab, yeah. It's not too strong.
No, it's fine.
So this is the musculocutaneous nerve which supplies the bicep. Nice. Okay. Okay, so 1 second. Just want to grab some needles. Too strong?
No, yeah.
Oh, that just died on me. There we go. There we go. How's that?
Yeah.
Got a nice pulsation going on here. Oh, okay. All right. So we'll do the bicep and then we will retest you. Crossing fingers, it all works out. It would be interesting to see what percentage it improves. I guess anything would be good, yeah. How's that?
That's right.
Too strong?
That's actually right. Right there is good.
That's fine, okay.
And we're meant to feel one area more than all others.
You may.
Yeah.
Which area do you feel more? Inside?
Yeah.
Yeah, because the outside is obviously inhibited. What I've noticed over time is that areas of injury and greater inhibition, you tend to feel a little less. We'll reduce the inside a little bit and we'll give the outside a little bit more impulse. How's that now?
Yeah, I feel the outside more.
Yeah? Okay. Is that balanced now? Is it too strong?
No, that's actually good.
It's good,
Yeah.
okay.
That's what I train my clients, but I train away out myself.
Okay. Let's take this out. Okay, brother, let's get you 6, please. Okay, guys, so we've just done our electro-stimulation. We're going to retest the right side and compare to before treatment and see if we've been able to have any effect. Let's get you to lift up. All right, let's go. Push. 1, 2, 3, rest. Again, 1, 2, 3, rest. Again, 1, 2, 3, rest. Okay. All right. Let's get you to push out. 1, 2, 3, rest. Again, 1, 2, 3, rest. Again, 1, 2, 3, rest. Okay, we're going to do abduction. Make a fist for me. Okay, let's go. 1, 2, 3, rest. Again, 1, 2, 3, rest. Again, 1, 2, 3, rest. Great. Okay. Bicep, yes. All right, let's go. 1, 2, 3, rest. Again, 1, 2, 3, rest. Again, 1, 2, 3, rest. How does that feel compared to before?
Yeah, it's firing, it's like reacting much better.
Okay. Let's go. 1, 2, 3, rest. Let's go. 1, 2, 3, rest. Let's go. 1, 2, 3, rest. All right, last test. Tricep extension. Okay. Let's go. 1, 2, 3, rest. Let's go. 1, 2, 3, rest. Let's go. 1, 2, 3, rest. Great. Okay. Right. Let's switch this off and let's compare. Okay. You want to take a seat for me?
Yeah.
Okay. So, elbow flexion before was 90 Newton meters. Okay. You want to take a guess what it is now?
It was 90, 90, right?
Yes.
110.
You want to take a guess?
123.
You are closer.
139.
142.
Wow.
It improved by 56%.
That's a big difference.
That's a big difference, okay? Let's see. Elbow flexion in supination. Okay, so this seems to have reduced by 3 Newton meters, okay? Elbow extension, okay? So tricep. This was basically the second most weakest area. Before 108 Newton meters, and now you guys want to take a guess?
It's 130.
Okay, so you went up now. Yeah. You want to take a guess?
121.
121. Okay, so you are closer. Okay, 155.
Wow.
Okay, so that's 43.4% improvement. Okay, so I'm not sure why your elbow flexion reduced. There could be several factors. I mean, I do know that when I inserted the needle around your superficial radial nerve here, we got a twitch response. I don't know if there's a sensitivity reflex which is affected your ability to activate the brachioradialis. But the two most important things, your bicep and your tricep, have improved as well. Yeah.
It's a good start.
Yeah. So if we go through, let's go through some other things as well. Let's see. Okay, so internal rotation went up by 16%. External rotation went down by 1.4%. I think when it's like 1% or 2%, it's negligible, you know.
Could also be because it's in that area where.
Yes.
Yeah.
Shoulder abduction went up by 8.8%. Okay, so basically we did, let's say 1, 2, 3, 4, 5, 6 tests. 4 went up quite substantially, 2 went down like negligibly, 2%. One is 1%, one is 2.4%. So that's really, really great. I mean, we felt the difference in the bicep and the tricep during the activation.
Yeah.
Okay, guys. So that brings an end to our session today. I mean, that was a really, really great improvement. I didn't expect that. I was thinking more along the lines of like 10%.
Yeah. I'm
You
surprised.
know?
I mean, I could feel the difference
Yeah.
in terms of contraction and
Yeah.
even just, the movement was fine. The muscles firing straight away once you've done that.
Yeah, incredible. Absolutely incredible. So I hope you guys enjoyed that. I mean, it was something new. If you guys want to see more videos like this, please let me know. Do you want to let our followers know where they can find you, and
Yeah.
should they want to do some online coaching or one-on-one coaching?
Yeah. So you can find me on Justin Palser. So I'm a personal trainer out here in Dubai. I do in-person personal training as well as some online coaching as well. So info@justinpalser.com is my email address. Yeah, it's perfect.
Yeah,
Drop
so
me an email if you guys are interested, and we'll reach out.
we'll put in some contact details for Justin in the description below. Thank you very much for watching, guys. I hope to see you soon. Please hit the like button, subscribe, and drop any comments or any questions in the comment section. Cheers.